దూరవిద్యా విధానంలో డాక్టర్ బిఆర్ అంబేద్కర్ ఓపెన్ యూనివర్సిటీ దేశంలోనే మొట్టమొదటి సార్వత్రిక విశ్వవిద్యాలయం. దాదాపు 2.5 దశాబ్దాలుగా దూరవిద్యా విధానం ద్వారా కంప్యూటర్ కోర్సును అనుసంధానం చేస్తూ BA, BCom, BSc డిగ్రీ కోర్సులను అందిస్తోంది. పోస్ట్ గ్రాడ్యుయేషన్ స్థాయి, డిగ్రీ, డిప్లొమా స్థాయి కోర్సులను ఔత్సాహికులైన విద్యార్థులకు అందిస్తోంది. డెవలప్మెంట్ స్టడీస్లో సెంటర్ ఫర్ ఎకనామిక్స్ అండ్ సోషల్ స్టడీస్ ద్వారా MPhil, PhDతో పాటు విశ్వవిద్యాలయమే స్వయంగా దూర విద్యా విధాన అంశంపైన PhD వంటి పరిశోధన కోర్సులు ప్రవేశపెట్టింది. రాష్ట్ర వ్యాప్తంగా సుమారు 4.5 లక్షల మంది విద్యార్థులు ఈ విశ్వవిద్యాలయం నుంచి ఉన్నత విద్యావకాశాలు పొందుతున్నారు. డాక్టర్ బిఆర్ అంబేద్కర్ సార్వత్రిక విశ్వవిద్యాలయం స్థానికంగా స్వయం బోధనా పద్ధతిలో ముద్రణ రూపంలో రూపొందించిన కోర్స్ మెటీరియల్ అందిస్తోంది. కోర్స్ మెటీరియల్ అధ్యయనానికి సహకరించే విధంగా రేడియో, టెలివిజన్ పాఠ్యాంశాల ఆధారంగా కార్యక్రమాలు ప్రసారం చేస్తోంది. అధ్యయన కేంద్రాల ద్వారా ఏర్పాటు చేసే సలహా సంసర్గ తరగతులు, సైన్స్ ప్రాక్టికల్ సౌకర్యాలు విద్యార్థులకు స్వయం అధ్యయనానికి ఒక చక్కటి అవకాశం. ఇవి విద్యార్థి సమీపంలో ఉండే అధ్యయన కేంద్రం నుంచే పొందొచ్చు.
Welcome. Today's program is on behavior modification. This is an important aspect in psychology. Let us understand first the meaning and characteristics and assumptions of behavior modification. The first, what is behavior? Behavior is any activity of an individual. The behavior can be desirable or undesirable. Behavior can be socially acceptable or socially unacceptable. The behavior can be measured and also behavior can be observable. Then the important question is, can we modify the behavior? Yes, we can modify the behavior by employing suitable techniques, behavior modification techniques. We can change the behavior of human beings. Then what are the assumptions of this behavior modification? The assumptions are the learning is a learned activity. Basically, anything learned can be unlearned, and this is also based on environmental. Environment influence our behavior, and the principles, learning principles, are employed in the behavior modification, and the way in which undesirable behaviors are adopted by the individuals, in the same way desirable behavior also can be adopted. Then let us see the theoretical background of this behavior modification. The behaviorists like Watson, Pavlov, Skinner and Bandura, they contributed a lot to the field of this behavior modification. They said that behavior is observable, so we can modify the behavior. Here the classical conditioning is one that is proposed by the Pavlov. In this conditioning, the stimulus, the neutral stimulus is associated with the unconditional stimulus for a constant period of time. Then the neutral stimulus becomes original stimulus and elicits the same response as that of unconditioned stimulus. Another important theory which found basis for this behavior modification is operant conditioning. It is developed by the Skinner here the consequences are important. The operant conditioning theories, they focus on response, while classical conditioning theorists, they focus on stimulus. For classical conditioning theories, antecedents are important, and for operant conditioning theories, consequences are important. If the response elicits present experiences, that response will be continued. Another theory is social learning theory proposed by the Bandura. He said the children acquire behavior by modeling. The way they acquire different behaviors by watching, simply watching the individuals around them. And the another important question in this area is, why should we modify the behavior? Yes, we need to modify the behavior, because there are problem behaviors. If we do not address these problem behaviors, it will cause a lot of harm both to the individual and to the society. So, by applying behavior modification techniques, we need to address the behavior which is destructive to the society and which is destructive to the individual. And this another thing is the importance of this behavioral modification. If the undesirable behaviors are not removed, it will affect their career development, it will affect their academic growth development. So, as behavior can be changed or modified by applying suitable techniques, we can also replace undesirable behaviors with the desirable behaviors. Another technique here is, another approach is cognitive approach. While the behaviorists, they focus on environment, the cognitive theorists, they focus on internal aspect of the individual. They focus on the mind, whereas behaviorists, they ignore the mind. The cognitive theorists, they said, by altering the thinking process, we can change the behavior of the person. And the thing is, the interventions of this cognitive theories, just altering the perceptions, altering the thinking process, altering the beliefs of the people, we can change the behavior. So, what is this cognitive theory approach, cognitive approach and behavioral approach, they all combined together, and finally, the new approach came, that is cognitive behavioral therapy, that is CBT. Regarding behavior modification, the meaning is, it is a systematic approach through which we can change the behavior by applying the learning principles. So, this is an important aspect to change the behavior. To discuss these different aspects relating to behavioral modification, eminent people have come. There are two experts to discuss the issues relating to the problem, the behavioral modification. Left here is an expert, Dr.Saroja Aarya. She has worked in National Institute of Mentally Handicapped. She is a professor there. She has vast experience in the field, in that field. Another expert who has come here is Dr. Niranjan Reddy. He is a professor of clinical psychology. He has vast experience in counseling psychology. So, now we will discuss different aspects of the behavioral modification. And here viewers are now requested, if they have any doubts, if they need any clarification on various issues of behavioral modification, they can call us after 2:30, The phone numbers are 040 2703 1431. Another number is 040 2703 1432. Another number is 040 2703 1433. You can call us after 2:30. Now, we will start the discussion on behavior modification. So, Dr. Niranjan Reddy sir, you have vast experience in clinical psychology. You have also professional experience in counseling. You might be adopting this behavior modification techniques.
True.
So, before we discuss the behavior modification techniques, let us discuss the theoretical background of this behavior modification. The behaviorists, the theories, especially the operant conditioning and also social learning theory, they contributed a lot to this subject like behavior modification. Will you please explain the role of this operant conditioning theory and also social learning theory and how this has developed?
Certainly, I will do, sir. In fact, the very philosophy of behavior modification is human behavior is learned. All the human behavior, learning principles play very important role in shaping behavior of the human beings. Not only normal behavior, even for abnormal behavior also it is learned behavior. Same learning principles play important role in this particular behavior. Now, other important point is any behavior that can be learned can be unlearned also. So, that means a behavior which is abnormal, let us say maladaptive, can be unlearned again using the same learning principles. So, that is a basic proposition of the behavior modification. As sir has asked me to talk about operand conditioning, yes, in fact, most of the behavior modification techniques are based on operand conditioning, not only just on one operand conditioning, but this plays most important role. If you want me to explain operand conditioning in just one sentence, I would say it is learning through the consequences of behavior. See, individual does a behavior. If that particular behavior leads to positive effects, it leads to satisfaction, and the same behavior will be done again and again. Let us take a simple example. In a class, a student, let us say, asks a question when a teacher or a lecturer giving a lecture. Now, if the teacher says it is a wonderful question, I invite questions like this, I am really happy about you, you are a good person, good student. Now, because of that positive consequences, the students would do the same behavior again, that is asking the question. On the contrary, let us say when a student asks a question, lecturer says, don't disturb me while talking. If you have got any doubt, you should have asked later. You should not disturb me like this asking question. So, that means it is leading to negative consequences. As it is leading to negative consequences, the behavior will not be done. So, positive consequences, if at all present, behavior will be done. If the consequences are negative, the behavior will not occur again. So, this is basic principle of operand conditioning introduced by B.F. Skinner. And the second important thing is social loading theory. Albert Bandura has introduced this particular theory. Now, according to him, in society there are a number of people. All these people act as a models for us. So, that means it could be parents or it could be teachers, it could be other important persons in the life of the individual. They all are models. Now, this particular person observes a model of the other person. Now, he tries to behave the way he does. Now, this is observational loading. And here there is one more thing. Now, this particular individual not only observes others models behavior, he observes the behavior and he knows the consequences for the behavior. Suppose if that particular individual's behavior outcome is not positive, the fellow will not do it. So, this is social learning theory by Albert Bandura sir.
Yes, very good. Then the madam, Dr. Reddy has explained the theoretical basis of this behavior modification. As you know, the goal of behavior modification is to change the maladaptive behavior to bring in desirable behavior. It means there are problems, there are problem behaviors are there. Will you please explain what are the problem behaviors and what are the causes of the problem behaviors and how to identify these problem behaviors?
Yes. All behaviors can be classified into two groups. One is adaptive behaviors or skill behaviors are desirable because they help us in learning and help us efficiently to carry out our activities of daily life. There are three kinds of all adaptive behaviors can be classified. Conceptual skills, that is learning concept of time, money, arithmetic, reading, writing. Social skills, interpersonal skills, and third is the practical skills, taking care of oneself, the occupational, traveling independently, self-direction. Good adaptive behaviors are important for leading independence to children at home, school and community. The other category is maladaptive behaviors or problem behaviors are undesirable because they interfere in learning as well as pose difficulties in carrying out everyday activities of life. Maladaptive behaviors or problem behaviors are also learnt as good behaviors. All undesirable behaviors cannot be considered problematic. For example, a person dozing off in a meeting is undesirable, but it need not be problematic. A behavior can be considered problematic when it is dangerous to self or others, when it is interferes with one's own learning and others' learning, not age appropriate and socially unacceptable. There are many types of problem behaviors like physical harm towards others, beating or pinching others, damages property, violent and destructive behavior, tearing of books, tearing of clothes, damaging furniture. Other behaviors like temper tantrums, excessive crying, screaming, shouting, rolling on the floor. Self-injurious behaviors like pulling one's hair, biting, peeling of wounds from one's own body. Odd behaviors like laughing or smiling without any reason or collecting rubbish, misbehavior towards others, pushing or grabbing objects from others or spitting on others. Hyperactivity is another problematic behavior where a child cannot sit at one place for a long time, cannot complete the task assigned. Rebellious behavior like refuses to obey commands and do the opposite of what is being told. Stereotyped or repetitive behaviors like rocking the body or finger flapping. Antisocial behaviors like cheating, stealing, gambling. There can be also problem behaviors of fears, fears of places, objects, animals. Another problem behavior is sexual behavior, maybe like masturbating in public or touching private parts of the body. As regards what causes these problem behaviors, there are a host of biological, psychological, social and emotional factors that contribute towards the individual having problem behaviors. Research studies have shown that each behavior is linked with a reward or with a benefit. So, children indulge in problem behaviors when they are rewarding. Now, let us look at what are these rewards for which children develop and indulge in problem behaviors.
Then can you identify these problem behaviors? So, now you have said explain the causes of problem behaviors and the nature of problem behaviors. Can you identify these problems? Identification process.
Yes, we can. I also wanted to say what are the benefits linked.
Okay.
Mostly it will be attention seeking is another
Attention, right.
benefit.
That is why they are behaving
I
like
think
that.
all of us love to seek attention, and children are great attention seekers. And any behavior that helps the child to get an eye contact of the parent or the teacher, get a hug, get a pat, will try to indulge in problem behaviors. Most of the time we do not pay attention to desirable behaviors, hence the child tries to push things, throw things to get parental attention. It can be escape. Some of the children indulge in problem behaviors to escape a difficult situation. Child can write, but wants to escape writing. So, will throw things, will throw away the material, and the teacher may ask the child to go out of the class. Teacher thinks it is a punishing the child, but it is rewarding to the child because child can escape writing, and hence the child may indulge in this behavior again and again. Some behaviors are self-stimulatory and like body rocking, and the child indulges in this. Some of the behaviors helps the children to fetch material rewards. Like if a child rolls on the floor or shows head banging, may get a chocolate which the child wants. Hence, most of the problem behaviors are maintained and continued because we reward them, because they are rewarding to the child. As regards identification of problem behaviors, generally we use direct observation techniques, clinical interview with the parents and other significant members to find out how the child behaves in the school, in the class and at home. And also we use behavior rating scales. At National Institute for the Mentally Handicapped, we developed and standardized maladaptive behavior checklist, problem behavior checklist. We developed another very good test, behavioral assessment of Indian children for having mental retardation, for both for the children version as well as for the adults. And then we do a functional analysis which is called as ABC model. What we need to understand for each problem behavior, before we plan the management program, we need a behavioral assessment, and we need to understand what are the causes leading to the behavior and what are the consequences as Sir said. So, what we do is try to find out for the each problem behavior which we want to deal with or manage is what happened immediately before the problem behavior, which we call as antecedents, what happened during the behavior and what happened immediately after the behavior, which we called as consequence. If the child comes and says, "Mom, I have stolen this and brought at home," what is the mother's reaction? Is she going to give a slap or is she going to praise the child? That is what is the consequence. So, for developing behavior intervention management program for the children, what we do is we do behavioral assessment and we request the parents to maintain a weekly chart for all the 7 days. How frequent, what we say is frequency recording, how frequently it occurs, duration, what length of time it occurs, interval, how many times it occur in a specified time. Based on this assessment, then we develop tailor-made individual behavior modification program.
Okay, okay, madam. Dr. Reddy sir, this is engineer. So, madam said there are different types of problem behaviors.
Yes.
And they are socially unacceptable and sometimes are destructive also. Are there any techniques to change the behavior, particularly the maladaptive behavior or particularly undesirable behavior?
Yes, there are number of techniques in fact available. Entire behavior modification in fact based on these particular principles. One simple technique that we frequently use is environmental manipulation. In the sense, see, a child starts behaving maladaptively, let us say in one particular situation, maybe a family, maybe classroom, maybe somewhere. What we have got to do is, we have got to modify. Say, if the child is behaving maladaptively in the home, modify, change the environment, put him to some other place. So, it is a simple technique. Other one is, we call it as a technique of timeout. In technique of timeout, what we do is, if the kid in fact falling down, screaming, doing all that maladaptive behavior, he will be removed from that particular place. He will be placed in some other room for a while. The room is such, it will not have any other type of stimulating type of articles there, purely bald type of a room, so that nothing could catch the child's attention. He will be there as long as he is going to keep quiet. The moment he keeps quiet, he will be brought out. Suppose if he is doing the same behavior again, maladaptive behavior, again we will be put into the same room for a while. So, this is what we call as a timeout. Previously, parents used to use physical punishment in order to modify the behavior, but we know that physical punishment is not a good way of bringing up the children. So, instead of a physical punishment, this technique of timeout could definitely help. The other important technique that we use in order to enhance a better behavior is token economy. Now, whenever we are doing token economy, first what we are going to do is, we are going to split the behavior. We should not think that the whole behavior we are going to change in a single session. It will be broken into a number of things. For example, a child, the moment he comes from school, he has to put his shoe in one place, he has got to put his books in proper place, he has got to wash his hands, have his snacks, later on he must complete his homework, subsequently he should go for play, then come back again read. So, these are various things. What we do is, now we take up each behavior and we reward it. Reward in the sense, we give a token. Token, it could be anything, a plastic chip, whatever it may be. Now, when whenever he gets the token, the child can exchange the token for any other reward which he likes. So, like this, it is known as token economy. This is another technique that we use. So, there are number.
Right. Dr. Reddy, you have clearly explained the various techniques that can be used for modifying the behavior. Madam, you have explained different techniques, like by employing the technique like environmental manipulation and the extinction and timeout and token economy, we can change the behavior. Are there any other methods, madam, to change the behavior?
Yeah. For certain behaviors like violent behavior or head banging, we use physical restraint. That is, restricting the physical movements of the child of either the part of the body or the whole body. Like holding hands, if the child is doing self-injurious behavior of biting oneself or pulling one's hair, then we need to hold. And this is physically restrained for a while, for a short while, and then we always have to move on to see if the child is not indulging in problem behavior, we leave the child and reward for not indulging in problem behavior, so that the good behaviors develop. Then there is another technique like what we call restitution or overcorrection, which means correcting the situation more than the normal. That is, suppose if a child has thrown food wantonly or urinates wantonly, knows how, has the control, but does it wantonly, then we request the child or make the child clean that much, not just clean that much floor where the food is thrown, but mop the whole room, overcorrection. Okay, right. Or not only wash the clothes that the child has soiled, but wash all his clothes. So, the child has to learn not to indulge in such things, and once the child behaves properly, it is rewarded. So, then we have extinction. Extinction is a very important technique which can be used both with children and adults. It is meaning ignoring for a problem behavior or indifference. Okay. Most of the time, as I said earlier, we need attention. So, children and adults both indulge in behaviors for seeking attention. Yeah. So, extinction means not paying attention. no physical contact, no lecturing, no eye contact, it is just leaving the child, and it works wonders. If we just take an example of universal strikes, people go on strikes and they know that once they go on strike, their demands are met. But generally management meets the demand after the strike.
Right.
Whereas if the demands are discussed earlier, or they should not meet the demands. Like if we look at AP state, some years back, NGOs went on strike, but for 61 days they were not paid and they came back to the duty. That is extinction. So if attention is not paid at all, like if the child rolls on the floor for getting a chocolate, if we leave the child alone for some time, although it is difficult,
Ignoring him,
but yeah, ignoring, then the child learns that it won't fetch anything. While instead when the child is quiet and behaves well, we can reward.
Right.
Yeah.
We have discussed, Dr. Niranjan, so far we have discussed the techniques that can be employed for changing the maladaptive behavior or undesirable behavior. Another important thing in the here is how to create the good behavior, or the desirable behavior or appropriate behavior. Are there any techniques to create the appropriate behavior among children and also the adults?
In order to initiate a new healthy behavior, or maybe the healthy behavior is there, but it is occurring less frequently, its frequency has to be increased. In order to do that, the best important technique that usually being used is, one is token economy, second thing is positive reinforcement.
Right.
So, whenever the child is indulging in appropriate behavior, the behavior which is supposed to indulge, now he will be rewarded. As we keep on rewarding, the frequency of this healthy behavior gradually increases. Now, the negative reinforcement gradually decreases the negative behavior, whereas positive reinforcement gradually enhances the frequency of its occurrence. So, finally, it becomes a habit in the child's behavior.
Right. Like he explained the various techniques that can be used for changing for creation of the appropriate behaviors. Are there any other techniques?
Yeah. Behavior modification technology actually is used for both developing new behaviors, increasing desirable behaviors and decreasing undesirable behaviors. Now, for developing new behaviors, the techniques used are shaping, chaining,
okay.
Yes.
prompting. Now, shaping is where you start rewarding or applying reinforcement to closer approximation of the desired behavior. If I want the child to start learning to write, I do not need to wait till the child starts writing and reward. Even if the child, the closer approximation is able to hold the pencil, I should give a reward. Then hold properly and closer approximations, step by step we keep rewarding. The child keeps advancing in its development, in its desired behavior or the new behavior which we want the child to learn. Then chaining is again whatever behavior we want the child to learn, a new behavior needs to be divided into simple steps, a complex task divided into simple steps, and we start teaching the child step by step, one step. We may go forward chaining or backward chaining, start from the last step, master it, go to the next step, or start from the first step, master it and go to the forward chaining or backward chaining. Once the behavior is established, the new behavior of writing or learning is established, then one can also do fading. We also add prompts. Prompting is another technique, like manually guiding is the manual prompts, verbally guiding. We want the child to wash hands before eating. So, sometimes we may have to hold the child and take it to the sink, is manually prompting the child, or verbally after that is established you can just say wash your hands, and then only gesturally you can just show the sink and ask the child to wash the hands. So, once the desired behaviors or the new behaviors are established, then we can do fading of the prompts. Slowly we need not continue with the prompts and the fading can be done. These 4 techniques are very useful in developing new behaviors.
Can you also use the modeling technique?
I think modeling and imitation is the most
Imitation,
important
yeah.
technique. I think
That is what
parents,
Bandura said, that
no,
modeling is
all
on-
of us learn through
imitation.
imitation and modeling. Parents and teachers are the best models for the child to learn.
Okay, through modeling also we can change the
Yes,
behavior.
sure.
So, the another thing is the reinforcement. There is
Yeah.
a dominant tool of this operant conditioning, and it is much used in behavior modification. And can you explain the reinforcement, different types of reinforcement and differential reinforcement like this?
Yeah, reinforcement is any event that increases the probability of a behavior to reoccur.
Right.
That is, the meaning is that a reinforcement applied immediately after a behavior is likely to occur again and again.
Okay.
When you give a reinforcement immediately after a behavior, it is likely to occur again and again. So, as Dr. Reddy has said, there are 2 kinds of reinforcement: positive reinforcement and negative
Negative
reinforcement. Positive reinforcement is presentation of a reward or a pleasant stimulus to increase the probability of desirable behaviors. Now, in the positive reinforcement, any events can act as reinforcers. Like there can be primary rewards and the secondary rewards. Primary rewards generally have survival value, like food and drink. So, if we want to train the child to develop new behaviors or reduce maladaptive behaviors, we may use primary rewards like giving sweets, bananas, biscuits. Secondary rewards include material rewards, social rewards, activities, privileges, tokens, as Sir said. Now, material rewards can be, buying new clothes or toys. Social rewards
Hello.
is generally
There is a phone call.
shabash.
Hello. Hello. Yes.
Hello.
Please, you can ask the question.
Hello.
Hello.
Yeah, namaste sir.
చెప్పండి.
నా పేరు శ్రీనివాసరావు అండి. మేడం ఎన్ఐఎంఎస్ కదండి.
అవునండి.
సార్ మా బాబుకి ఒక చిన్న ప్రాబ్లం ఉంది, సెరిబ్రల్ పాలసీ. అయితే ఐ వాంట్ టు హ్యావ్ ఫర్ టేక్ ఐడియా హౌ టు గో ఫర్దర్ అండ్ ఆల్. ఓకే, సో జస్ట్ కెన్ ఐ టాక్ టు సర్?
మీకు స్పెసిఫిక్ ప్రాబ్లం చెప్పండి.
ప్రాబ్లం ఇస్ లైక్ హీ ఈస్ హ్యావింగ్ డిలేడ్ మైల్స్టోన్స్ బికాస్ ఆఫ్ వర్క్ ప్రాబ్లం.
Okay. Okay. Can you respond?
Yeah. Can you tell what is the age of the child and what are the behavior problems?
ఏమండి మీ అబ్బాయి ఏజ్ ఏజ్
హలో.
3 years. హలో, మీ అబ్బాయి ఏజ్ అండి.
హలో.
నెక్స్ట్ కాల్. ఓకే.
Or he can come to NIMH.
ఓకే, మీరు ఏం చేస్తారంటే ఎన్ఐఎంహెచ్ ఇక్కడ హైదరాబాద్లో ఉన్నది, సికింద్రాబాద్.
We can help him.
నేషనల్ ఇన్స్టిట్యూట్ ఆఫ్ మెంటల్ హ్యాండిక్యాప్ అది. అక్కడికి వెళ్ళి మేడం గారు ఉంటే మీరు మేడంతో డిస్కస్ చేయొచ్చండి ఇక్కడ.
We can help him. We can help him.
వీ కెన్ హెల్ప్ అండి. అంటే మీరు డిస్కషన్ అది మీ క్వశ్చన్కు ఆన్సర్ చెప్పడానికి చాలా సమయం పడుతుంది. అది మీరు మీ మేడం గారు అక్కడ నేషనల్ ఇన్స్టిట్యూట్ ఆఫ్ అక్కడ ఉంటారు, అక్కడ సికింద్రాబాద్లో. మీరు మేడంకి అక్కడ వెళ్ళి మీరు డిస్కస్ చేసినట్టయితే కావాల్సిన సొల్యూషన్ చెప్తారు వాళ్ళు.
We can help him.
మీకు సహాయం హెల్ప్ చేస్తారు. ఓకే మేడం. Is the next call? Okay, right. We can continue, madam. You are talking about the modeling, the role of modeling, reinforcement.
Yeah. So, material reinforcement includes material rewards can be just buying new clothes or giving toys to the child. Social rewards are very important. where you praise the child for the good behavior as well as say good work done, shabash. So in that situation we need not give any material or any sweets or something like that, just social rewards. Activities is allowing the child to watch a movie or techniques.
There is a phone call, ma'am. Again. Hello.
Hello.
Hello. Chappan. Hello. What is your problem or question?
Sir, actually, my papa 5 years ఉంది.
Hello. Chappan.
5 years age అయితే అంటే నార్మల్గా ఆ పాపకు అండర్స్టాండ్ అవుతలేదు ప్రాబ్లం ఏంటనేది. అంటే మనం నార్మల్గా ఎట్లా పిల్లలు ఎట్లా పరిగెత్తు ఎట్లా చేస్తారో అట్లా అండర్స్టాండ్ అవుతలేదు అన్నమాట.
ఓకే, మీకు ఇప్పుడు రైట్.
ఒకసారి ఎన్ఐహెచ్ఎం కూడా తీసుకొచ్చాను, బిహేవియర్ ప్రాబ్లం ఉందన్నారు కానీ బట్ మాకు అప్పుడు అంత అర్థం కాలేదు. 4 years తీసుకెళ్ళాము.
ఓకే,
ఇప్పుడంటే నార్మల్ పిల్లలు ఆ పాపకి ఏమైనా చెప్పినా కానీ సడన్ గా అండర్స్టాండ్ చేసుకోలేదు అనమాట.
రైట్.
అంటే కొద్దిగా వాకింగ్ నడవటం కూడా కొద్దిగా ప్రాబ్లమేటిక్ గా కనిపిస్తుంది అనమాట. అంటే కొద్దిగా ఫాస్ట్ గా పరిగెత్తలేదు. అంటే మనం ఏదైనా చెప్తే దాన్ని రిపీటెడ్ గా చేస్తూ ఉంటుంది. ఏదైనా ప్రాబ్లమ్ ఏదైనా మనం ఏదైనా కొద్దిగా ఏదైనా చెప్పామంటే దాన్ని రిపీట్ గా చేస్తూ ఉంటుంది.
ఓకే ఓకే, ఒక అర్థమవుతుంది మేడం, నేను చెప్పగలను.
There may be problem with the development of the brain. The child may have low level of mental development. Brain may not have developed fully, because of that poor understanding, inability to walk or inability to talk can be there. But as you said, you have already gone to NIMH and taken help. If there are any problems even now continuing, you kindly visit NIMH again, because these children need training consistently, continuously. It is not one time training. Just like sending children to school, these children take more time to learn, and hence we need to train them for a longer time. Please, you are requested to visit us again.
All right. Madam, there is another call. Hello.
Hello. Hello, sir.
The callers are requested to ask as far as possible academic questions relating to the MSc and others, Right.
హలో
హలో.
సార్, ఇది మాట్లాడదామని ఇందా కట్ అయింది.
ఓకే.
హలో
మాట్లాడు, చెప్పండి.
సార్, అది బాబు గురించి మాట్లాడదామని ఇందా చేశాను, కట్ అయినట్టుంది.
మీరు ఇదివరకు అడిగారు క్వశ్చన్, మేడం గారు కూడా చెప్పారు దాని. ఓకే, మేడం ఏం చెప్తున్నారు, మీరు ఇన్స్టిట్యూట్కి వెళ్ళినట్టయితే ఇన్స్టిట్యూట్ కదా, ఎందుకంటే ఆ మీకు దాన్ని ఎక్స్ప్లెయిన్ చేయడానికి చాలా టైం పడుతుంది. అది మీ కేసును కూడా ఎగ్జామిన్ చేయాల్సి వస్తుంది ఆ పేషెంట్ను, అమ్మాయి ఎవరిని. అప్పుడు మీరు నేషనల్ ఇన్స్టిట్యూట్ ఆఫ్ అక్కడ హ్యాండిక్యాప్డ్ అక్కడికి NIMHకి వెళ్ళినట్టయితే మేడం గారు మీకు హెల్ప్ చేస్తారు. రైట్.
Thank you.
Right. We can continue the discussion, madam. Reinforcement. Right.
Okay. The negative reinforcement is removal of aversive stimulus to increase the occurrence of desirable behavior.
Right.
Let's take an example of cars making alarm, sounding alarm when we don't put the belt or when the door is not properly closed. So, which is an unpleasant stimulus. Right. So, we learn to remove the unpleasant stimulus by increasing our desirable behavior of properly closing the doors of the class, of the cars, or putting the belt. So, it is like removal of the unpleasant stimulus helps us to indulge or increase our desirable behavior of putting the belt or properly closing the doors of the cars.
Right. We have so far discussed different techniques that can be employed to replace undesirable behavior with desirable behavior, and also discussed the different techniques to create a new behavior or good behavior. And now the different this modification or the behavior modification taken is a good technique. Dr. Niranjan Reddy, can you please explain where this technique is much useful, where you can the application aspect of this behavior modification?
In fact, behavior modification has a wider perspective for its application. It can be applied in the schools. Let us say a student is not behaving well, maybe he is having lots of behavioral problems. A teacher can apply this behavior modification in order to alter, modify, change the behavior of the student. So, it can be used in the school, it can be also used in prisons, because in prison population they also have lots of maladaptive behaviors. So, jailers can apply this behavior modification techniques in order to modify their behavior. Now, behavior modification can be applied in industries also. By using this behavior modification, their performance is going to be improved and the production is going to be much more improved. So, that means behavior modification techniques can be used anywhere, in the family setting, in the school setting, in the prison, everywhere it can be used. Whereas, behavior therapy mostly that is of course we use in only hospital setup, psychiatric setup, but whereas behavior modification has a wider perspective, you can use it in number of places.
Yes, it has wider applications. Right, madam, there is another approach like the behavior modification, that is called positive behavioral support, that is PBS. They said, the psychologists like Kozel said that deficiencies in the environment and deficiencies in the individual ignored in the behavior modification approach. Of course, there is a continuation of this behavior modification. Will you please enlight in this positive behavior support?
Sure. Positive behavioral support is a newly emerging concept in behavior modification technology. The basic crux or the basic principle of PBS is, let us prevent problem behaviors to occur.
So, prevention is better than, okay.
Yeah. That is by changing the environment before the problem behavior occurs, and changing the teaching strategies for children who cannot learn in normal environment. By definition, it is called remediation of the deficient context. So, remedying the environment in which problem behaviors are likely to occur. So, in case we modify the environment or restructure or change the environment before the problem behavior occurs, then it is positive behavioral support. It can be done for skill deficiencies of children as well as altering teaching strategies from the individual level as well as from the environmental level. If we can give social support, behavioral support, emotional support to the child, it is very likely that we prevent problem behaviors. That is the basic principle of problem behavioral support. And I would like to add that behavior modification, as sir said, is universally applied to all age groups at any settings, home, community, social, school, and to any age groups. Since we find some of the children who come to school have maladaptive behaviors or skill deficiencies, which is not conducive for learning or effective classroom teaching. Hence, the role of the parents and the teachers is not just to provide or satisfy the physical and the biological and the psychological needs of the child at home, and for the teachers to just provide a body of knowledge and skills to the child, but help the child to develop a repertoire of adaptive behavioral skills, which will help the child for optimal development and realization of their full potentials.
Now, let us focus our practical experiences. Dr. Niranjan Reddy garu, you have vast experience in clinical psychology and you are also a professional practitioner. And can you enlighten a few, explain one or two case studies which have, where you have applied this behavior modification techniques?
Yes, sir. In fact, I can tell you about two case studies. One, in fact, from my own personal experience. The second one is, of course, mostly a textbook. In the textbook, it is known as a Pascal's case history. Pascal is a very good boy. He used to behave very well, and at the same time parents used to like him most, giving lots of attention. Then Pascal's mother brought forth other child. Now there are that means brother to Pascal. Now after another couple of years, another 2 children also came addition in the family. Now attention that was being given to the Pascal was reduced. Now whenever the Pascal wanted attention, he used to in fact pinch the brother or pinch the sister. Then mother would look at him and say, Pascal, you are a nice boy, don't do it. Now that means whenever the boy is doing a mischief, the parent is attending him. When he was not doing well, he was not when he was not doing any mischief, she was not attending at all. So gradually the Pascal became a rascal. Now he started behaving all abnormally. When the particular person was taken to a clinical psychologist, they said, see, the way you are giving attention is wrong. So pay attention when the boy behaves well. Don't pay attention when the boy does not behave well. So when this was reversed, there was a good improvement in that particular Pascal's behavior. And one from my personal experience, a divorcee having a child. Now she was doing work from home, all the time busy, at the same time bringing up the child. The child goes to mother and says, Mom, I need a biscuit. But she used to be very busy. She would say, wait for a minute. Now it goes on like this. Then the child would throw a tantrum, lie down on the ground, scream. Then she would gradually go get up from her seat. She would go to the place where the biscuit is kept, and she gave. This went on number of times. Then the child gradually learned that if I need a chocolate, if I need a biscuit, all that I have to do is I must throw a temper tantrum. So that's what it was done. So when this was explained to the mother, when she was asked to change her behavior, the boy gradually improved in her behavior. That's why there are no problem children, there are only problem parents. The parents' behavior gradually leads in the development of the problem behaviors.
Right, you explained your personal experiences in the counseling. Madam, you have been working with mentally handicapped children and other in our institute, National Institute of Mentally Handicapped. Will you please throw some light on your experiences, personal experiences in this field?
About 60% of children or adults with mental handicap have problem behaviors. And as we discussed the causes, there is no goal directed activity for these individuals, hence they develop problem behaviors. Another is skill deficiency. When they cannot communicate for what they want, then nobody understands their needs, they will grab, they will throw temper tantrums. These are some of the reasons for them to develop problem behaviors. Now, we deal with each of the problem behavior of children who come to NIMH. As I said, 60% of them have, quite a few of them have hyperactivity, self-injurious behaviors, rebellious behavior, antisocial, repetitive, all the behaviors what we have listed. What we do is, as I said, detailed assessment, then we make a list of problem behaviors, prioritize or develop the first hierarchy, then prioritize. We can develop behavior management program only for 2-3 behaviors at a time. We cannot deal with all the behaviors. So these are developed for 2-3 behaviors, target behaviors which we call them, and then we do the evaluation assessment and take help of the parents to bring the baseline recording, how often the behavior occurs, when it occurs, is it in presence of a person, situation. Accordingly, then we plan the management program and demonstrate to the parents and then ask them to carry out. So in a school setting, we do it baseline, quarterly assessment, and then at the end of the year. In home setting, we almost bi-weekly they come to us, we see whether the program is running properly and then we help. Most of the time problem behaviors are dealt with, child is free from the problem behaviors if the program is carried out properly. Now, 3 things are required for carrying out a good behavior modification program. Systematically it should be used, consistently, and it should be generalized. A good behavior should not be only in the class, it should be at home, it should be in the marketplace. If you allow me, I will just give one case study. A child about 13 years was brought to us spitting at everyone, was spitting on the clerk, spitting on us, and I took for behavior modification program, and my challenge was by the child goes home there should be no spitting. And the child was spitting on my face, spitting all over to me. It took me about 1.5 to 2 hours to give the first session.
Okay, thank you.
And I realized the child was spitting for attention seeking, and when I was not giving attention, it became all right. The child went home without spitting.
Okay, thank you, madam. Thank you, Dr. Niranjan. We have so far we explained various aspects of behavior modification, the meaning and other thing, and the techniques that can be used for changing the behavior. So, thank you, madam. Thank you, and
Thank
Dr.
you, sir.
Niranjan.
Thank you.
Thank you.